In fact, when Dr. Narayanan has took over as the chairman, the president, he started his action plan with a child rights, protection of child rights as his motto, and more than 40, nearly 40 programs were planned in that line. And I'm happy that almost all of them were able to complete it. And I thank all the branches for taking interest in doing the completing the most of the project. As already said by Dr. Sonu as well as Narayanan, child sex abuse is a serious violation of child rights. Child sex abuse is a serious violation of child rights, and the incidence is increasing day by day. The increase in the incidence may not be the actual number is increasing because we are reporting more cases. People are aware of this issue, so there is more reporting taking place, and number of cases are also in the increase. In many of the situations, doctors are the first contacts. In many situations, the child may not come to you with a direct complaint of child sex abuse. Sometimes it may some subtle psychological changes or physical changes only may be present, or sometimes it can be a STD or something like that. In those situations also, it is our responsibility to look at the depth of the problem, identify the issue, and do the appropriate treatment as well as reporting. So, as you all know, in 2012, special legislation has been passed in the Parliament, that is the Protection of Children Against Sexual Offences Act, that is Pocso Act. The Act very clearly denote what are the offences, what are the punishments, what are the responsibilities of each and every stakeholders. As one of the major stakeholders in this issue, doctors has a primary responsibility of identifying and treating the patient, as well as reporting the cases to the authority. That is the mandatory reporting. And if you are not doing the mandatory reporting, you can be punished for not reporting the issue. So we have to look into this problem in two different aspects. That is our therapeutic aspect as well as the legal aspect. And all over and above, we have to keep in mind our ethical issues also. So our therapeutic aspect, we have to make a clear diagnosis. We have to do appropriate investigation. You have to get appropriate treatment and referrals to the needed special subspecialties like psychiatry or anything like that, so that these children are brought back to the mainstream of life. And the most dreaded complication or problem equally of child sexual abuse is the long-term psychological impacts. So that it is our responsibility to look at the that aspect. Today we are looking at the another aspect of child sex abuse and the Pocso Act, that is the legislature or legal aspect. For that, we have to understand exactly what is the law, and knowing to explain us about the details of the law, we have the IAP legal man, none other than Dr. George F. Moolayil. I think Dr. George F. Moolayil need no introduction to the august audience because he belongs to the Kottayam branch, and he was there for almost 20-30 years with IAP on different platforms. The next speaker is Dr. Shalini, is a police surgeon from Trivandrum Medical College, associate professor, and she will be deliberating on how to conduct a forensic examination and how to take evidences in a child with sexual abuse, and what are the formalities a doctor has to be kept in mind. The formalities in collecting the evidence should be taken very seriously, because if any of these points goes not recorded correctly, the case may go against the poor child and the culprit will escape. So our on the legal side, it is our responsibility to see that the child get the benefit always. With these words, I thank and congratulate Dr. Sunu and her team for conducting another, as Narayan said, is the 6th program of Child Rights Week. I request Dr. George F. Moolayil to start his. Is it okay, or there is a vote of thanks before that?
No, sir. That's only at the end.
Okay.
No, actually,
I
vote of
request
thanks.
Dr. George F. Moolayil to take over.
Hello.
Sir, thank you.
Are you going to give the vote of thanks now, or should I start?
You start, sir. Vote of thanks only at the end.
Okay. Just want to tell you one more thing. I'll start screen sharing, and then I won't be visible to you. So that is a problem with the iPad.
Yeah, that's
a good thing that you
always.
Anyway, you'll be hearing only my voice. Anyway, thanks, Ashok, for the good words you have told me about me. One thing, and actually, who said? Okay. Can you see the slides?
No.
What happened?
No, sir.
Not seen.
Let me see. Now can you see?
Yeah.
Yes, sir.
Yes, sir.
Yes.
Okay. Anyhow, we have got. I just let me say something about Narayan first, because we have got a president who really cares for the children, because he had arranged so many programs, and I think he must be the first president who has taken so much of interest in child rights and protecting the children from sexual abuse. So, as Ashok Kumar has said, the Act came into 2012, that is Protection of Children Against Sexual Offences. And actually, there was an amendment again last year where they had included death penalty also. Now, why such a topic has come or has to be presented to the doctors is because many of the doctors do not know what to do when they face with such a problem. Because I know, because many doctors had called me to ask for my opinion, and some doctors called me very late, because when they were called to the court to give evidence, so they don't know. So it's a good thing that such a thing has been. We have started a program like this. This is a common scenario which happens. A child is brought to a pediatrician with vague abdominal complaints. Probably the child might not have even told the parents that there was a problem or some kind of abuse was going on with the child. And when the doctor is examining, or when he has taken the history, it was revealed that she was being sexually abused by a relative. Usually, most of the cases of child sexual abuse is the culprit is usually either a relative or a neighbor or somebody whom the child knows. The child may be scared to tell others also. So, the fact was informed to the mother of a child. I'm just telling a scenario or hypothetical situation. The fact was informed to the mother of the child. And usually, because if it is a relative or somebody, a close relative, we have seen in the papers also that the mother might have kept quiet, and she requests the doctor to keep it as a secret for many other reasons. One, maybe due to the culprit being a relative, or it may affect the future of the child, etc., etc. So the doctor is in a dilemma, because maybe doctor may think that, why should I antagonize them, etc., etc. So what should the doctor do? Reporting is mandatory under Section 19 of Pocso Act. You have to report, whether it is a doctor or even a member of a public. Even for media also it's different. So failure to report is punishable under Section 21 of the Act. The imprisonment up to the fine, or the punishment is imprisonment up to 6 months. It can be fine or it can be even more. Because we have seen in the earlier cases also, the doctors were let off with a warning because they were not aware of the law or the act. But now I don't think it is possible because they are taking more stringent view of the act. So to whom should we report? That thing should be reported to the Special Juvenile Police Unit. Usually there may be special SJPU in many police stations, or if they are not there, we should report it to the local police. Now, next, what happened? What is the role of the doctor after that? We have to understand the feelings of the victim, because we have to give importance to the victim, not to any other factors. So we have to take a medical history of the child's experience in a facilitating, non-judgmental and empathetic manner. That means with all sympathy. We should not judge the child, or we should not put the blame on the child or make her feel guilty. Then we should document everything properly. Meticulous documenting of historical details should be there. And when we do the examination, we have to have a detailed examination to diagnose, first of all, whether sometimes, there may be false cases also. So we have to do a detailed examination to diagnose acute and chronic residual trauma and sexually transmitted diseases. Now, collecting forensic evidence is again another matter. We have to be very careful. We should not let any evidence go. It should not, every evidence is valid. We have seen, recently there was a case in UP, etc., where they tried to do an examination after 11 days of the incidents. So then you may not get many things. So collecting forensic evidence is a must. Consider differential diagnosis of behavioral complaints and physical signs. Okay, you have done the examination, you have got the history. You have to think whether anything else could have been the cause for the behavior of the child. Because, sometimes it may be a psychological problem or something like that. But then we have to consider everything also. Then you have to formulate a complete and thorough medical report with diagnosis and recommendation for treatment. The treatment can be curative, preventive, all those things I will be coming later on. And whenever you are called to the court, you have to come and testify. What is emergency medical care? All the hospitals are required to provide first aid or medical treatment free of cost. You can't charge the patient for this. In an emergency, I'm talking about the emergency situation. It should be rendered in such a manner to protect the privacy of the child. That means, unfortunately, sometimes, the privacy of the child may be maintained, but so and so, if the culprit is the father, his name is given, and they say, right, the father has abused the daughter or whatever it is, his child. So that means there is no privacy there actually. Then examination should be done in the presence of parent or guardian or a person whom the child has got confidence. Sometimes if the father is the culprit, maybe the child may not be having confidence in that. So you have to see when you get the history and all, you will have an idea also. And one thing is very important, you should not demand any legal or magisterial requisition as a pre-requisite. Means you cannot demand that, for doing an examination, you have to get a written request from the magistrate. No, it is not necessary. And treatment for cuts, bruises, and other injuries, including genitals, if any, should be done. Then we have to consider the possibility of sexually transmitted diseases and think about giving prophylaxis for that. And again, treatment for exposure to HIV, including prophylaxis. There you have to consult with an ID, infectious disease specialist. In a pubertal, the child who has attained puberty, you have to think about the possible pregnancy and chances of getting pregnant. And emergency contraceptives should be discussed in case of a pubertal child. As Ashokumar has said, you may have to consult or refer the patient elsewhere for other consultations. You have to refer the patient for consultation for mental or psychological help if necessary. And as I already said, collection of forensic evidence is very important. I'm sure Dr. Shalini will be talking about that after that. How to collect everything, how to do the proper detailed examinations and all. Then who can conduct the examination? Medical examination, this is a routine one, shall be conducted by a registered medical practitioner employed in a hospital run by government or local authority. This is routine, not emergency. In the absence of such an institution, any other registered medical practitioner can do the examination. If the victim is a girl child, it shall be conducted by a woman doctor. The victim can be a boy or a girl also. So if the victim is a girl child, it should be conducted by a woman doctor. And the examination should be done in the presence of parent, guardian, or person whom the child trusts. Because that is also very important. And if they are not available, then in the presence of a woman nominated by the head of the institution. Document questions asked and answers in the child's own words, simple words. That means you should not put words into the mouth of the child. Let the child talk by herself or himself and document the questions you ask, put it in a very simple way. Don't ask any uncomfortable questions. And document the answers which the child is giving. Conduct the examination in a very sensitive manner, empathetic. That is the most important thing, because the child should, when the child feels confident in you, that means she will be more open. And approach in a very sympathetic manner, empathetic is a must. Because if the child is scared of the doctor, it's as such the child may be a bit scared. So if the child doesn't have any confidence in the doctor or scared of the doctor, means she won't say anything. She may give another opinion. She may not open up to you. So you should be very empathetic. Adequate privacy should be there. Do not examine the child in a labor room where other ladies will be crying with labor pains and all. So that creates an additional trauma to the child. Collect and preserve forensic evidence, and clothing collection is very important, because you can get now with the modern technology, technical examination and all, you can get even from a very small thing, you can get evidence. So collection and preserve forensic evidence is a must. Refer the child for counseling whenever it is required. Now, informed consent for medical examination. This is again for routine examination. Written consent of the child, where you have to inform why you are doing it, what are things you are going to do, what are examination you are going to do, and make sure that the child understands what you tell them. And the child should voluntarily give the consent. If the child is too young or incapable, then you get the consent from the parents, guardian, or any other person whom the child has got confidence and who is in a responsible position for the child. And always document the presence of others who are present during the conversation, because you have done all these things in the presence of so and so, and should tell the parents that the doctor has a legal obligation to report to the authorities. That's a must. That is to protect you, and again to protect the child also. Because I know many times the mothers may say, please don't tell. I know, because some years back in the 80s, actually the culprit was the stepbrother of the child. The mother had married twice, and actually it was the first married child who had abused the younger daughter. And she was requesting me like anything that I should please don't say, etc., etc. So that is very important. The child never said that. Actually, came with the symptoms of that. Refusal of examination. If the child resists, try to convince the child, relax the child. If in spite of that, the child still refuses, that's an older child, defer the examination or abandon. Do not forcefully restrain the child for examination, exception being infants and young children. Use of sedation, whether you have to use sedation or not. Usually it's not needed. Consider sedation or GA only if the child refuses the examination and conditions requiring emergency medical attention. That should be highlighted. Requiring emergency medical attention, such as bleeding or a foreign body are suspected. Then you have to, because here it is you are doing it for the welfare of the child, for the health of the child. Conscious sedation is an option if examination and evidence collection is required and the child not able to cooperate. Maybe willing, but again not able to cooperate because of the physical pain or tension or fear. Speculum exam on a pre-pubertal girl should be done under anesthesia. Summary. Doctor in a case of child abuse has added responsibility, inform SJPU or local police irrespective of the wishes of parents. Please keep it in mind, because many times now actually the pediatricians are more aware of this, but unfortunately still some gynecologists are still not aware of this aspect, because many times they have called me also. Now I have been called to the court to bring bring all the evidence, the treatment record of the child, and then they say that they haven't done everything properly. Probably they might have written some other history. All those things are there. So we have to document. We have to inform. Whenever you suspect something, you have to inform them, and it is up to them to prove whether it is up to the police or the SJPU to prove whether an offence has taken place or not. And not reporting is punishable offence under Section 21 of Pocso Act. As I said, it's punishable up to 6 months. Medical examination, advice and treatment. Here, preventive should be there, curative should be there, in a privacy maintained, child-friendly, confidence-inspiring atmosphere. That single sentence is very important. You have to give advice, you have to treat, you have to give preventive measures and curative measures, and the privacy should be maintained, and the child should have confidence in you. The atmosphere should be in such an atmosphere. Taking samples of forensic evidence has to be there. I am sure the next speaker will be telling you about how to collect the forensic evidence. Counseling for the victim. Change of environment in a case of recurrent sexual abuse, because it is your duty to see that the child doesn't see or experience another sexual abuse hereafter after seeing it. Thank you very much. I've finished.
Okay, sir. Thank you, sir. Thank you for the wonderful and excellent talk. We'll go to discussion after the second talk too. So now I invite Dr. Shalini, Assistant Professor and Assistant Police Surgeon, Medical College Trivandrum, for the second talk.
If you let me, just let me stop it.
Dr. Shalini?
Yes, ma'am. Actually, I'm trying to share the.
Okay. Yeah.
Is it visible?
Yes, yes. Yes, Shalini.
Good evening to all. First of all, I thank all of you for inviting me for this talk. Actually, I have also made a hypothetical case scenario, which was already said by Jyoth sir. Anyway, I'll go through it. Case scenario. Ria, a 8-year-old girl, was presented with frequent episodes of acute abdominal pain for the past 6 months. There is no history of dysuria, diarrhea, or constipation. On examination, all systems were within normal limits. Urine routine examination, blood routine examination, liver function test, ultrasonography, abdomen, and endoscopy were within normal limits. As per the history given by her mother, she is doing well in school, but seems to be more withdrawn when she returned from visiting her grandfather. When the doctor talked with the child personally, she said that her grandfather touches her private parts and told her to keep it as a secret. So, if such a situation comes to us, in our opinion, especially in pediatricians OP, what will we do? That is the topic for today's session. Examination and reporting of child sexual abuse. So, child sexual abuse includes all types of sexual victimization of children, penetrative or non-penetrative sexual offenses, pornography, sexual harassment, then commercial sexual exploitation, sex tourism, and online sexual exploitation. So we can discuss this under the subheadings: introduction, informed consent, history taking, examination of the survivor, then collection of material objects, and opinion formation. As we all know, in India, Pocso Act came into force in 2012 to protect the children from offenses of sexual assault, sexual harassment, and pornography, and to establish special courts for the speedy trial of such offenses. As per this act, any sexual activity with a child below the age of 18 years is considered as a crime. That's the age. As per this act, the child is a person under the age of 18 years. So a survivor may approach a healthcare facility in 3 situations: for the treatment of the effects of assault, especially with psychosomatic symptoms, or with a police requisition after police complaint, or with a court directive. So every case of sexual assault is treated as a medical emergency, and treatment should be given free of cost to the survivors in all government and private hospitals. As per the Criminal Law Amendment Act 2013, Section 357 of Criminal Procedure Code, then denial of treatment of sexual offense survivors is punishable under Section 166B of Indian Penal Code with imprisonment up to 1 year with or without fine. Again, Section 21 of Pocso Act also describes the punishment for this act. The examination should be done without any delay, and report should be provided at the earliest. Treatment and investigation should be done at free of cost. Details of the Child Welfare Committee and station house officer, details of the station house officer of the nearest police station should be available at the hospital. So email ID, then contact details like telephone number should be available of these two. This Child Welfare Committee and station house officer should be available at the casualty of the hospital. So confidentiality should be maintained in each step of examination, material object collection, reporting, and intimation, police intimation. stepwise approach of child sexual offense waiver. It is given by the Ministry of Health, Government of India. Initial resuscitation or first aid, informed consent for examination, evidence collection and police procedures, detailed history taking, medical examination, age estimation in case of children where age proof is not available. When the investigating officer requests you for age estimation, that has to be done based on the physical, dental and radiological findings. Evidence collection as per protocol, documentation of all findings on all procedures, packing, sealing and handing over the collected evidence to the police, treatment of injuries, provide testing or prophylaxis for sexually transmitted infections, HIV, hepatitis B and pregnancy testing, then psychological support and counseling as and when necessary, referral to the shelter or legal authorities for further help. This is the checklist for this child sexual offense survivor examination. Coming to the prerequisites for examination, as per the guidelines of Government of Kerala, adequate space should be identified for child survivor examination in each hospital. Privacy should be there, in preferably a bath attached room with an examination table for examining the child in lithotomy position, lateral position or knee chest position as and when necessary. Then intimation book should be, separate intimation book should be there in the examination room. Usually we have intimation book for all the medical legal cases together in the casualty, but as per the guidelines, we should have a separate intimation book for the Pocso cases. Then register for police intimation, facilities for examination in accordance with the history stated by the child, then format and labels, forwarding note, etc. for material objects. Then stationary items has to be there. Examination തുടങ്ങി കഴിഞ്ഞിട്ട് ഓരോരോ സ്ഥലത്ത് പോയി ഓരോ സാധനങ്ങൾ എടുക്കാൻ പാടില്ല. So നല്ല privacy വേണം. Then all the required items should be there inside the Pocso examination room. And facilities for collection of blood and urine samples should be there. The glass slides, vaginal swabs for taking vaginal swabs, then microscopic slides, envelopes, staplers, then sealing wax, metallic seal, etc. should be there inside the examination room. So safe kit or sexual assault forensic evidence kit is a kit which contains the items required for examination of the survivor of a sexual offense. So this include paper envelopes for clothing in case of a child or a survivor brought within 96 hours of examination, 96 hours of assault, then clothing has to be removed from the child and that has to be sent for forensic evidence examination. So that in safe kit there are paper envelopes for clothing. If we are removing the clothes from the child, we have to provide another cloth for the child. It is the responsibility of the hospital to provide the clothes for the child or the survivor. Then plastic combs for taking this, hair samples or foreign hair. Then cotton swabs in tubes, microscopic slides, nail cutter for taking nail clippings, and then small scissors, distilled water, labels, butter paper, EDTA bottles, sterile bottles, sodium fluoride. In case of drugs, in cases suspected use of drugs or alcohol forcefully taken by the child, then we have to collect the urine and blood for the chemical analysis. In that case, that should be preserved in sodium fluoride. Then pregnancy detection kit, cotton gauze, forms and documents. So safe kit contains all these 16 items and it was provided to the government hospitals by National Health Mission till recently, but nowadays it is not available. But we have to keep all these items in the examination room separately. And who should examine? In case of a girl below 18 years, she should be examined only by a female registered medical practitioner or a female medical officer. Then examination of a girl survivor of vaginal penetrative assault brought within 96 hours of the assault should be undertaken by a female gynecologist if she is on duty in that institution at that time. In the absence of female gynecologist, a lady medical officer working in that institution and on duty can examine. The boy survivors by the duty medical officer. In case of transgenders, choice as to the gender of the examiner may be provided to the survivor. In government medical colleges, a survivor brought during the working hours of the Department of Forensic Medicine and with a requisition addressing the head of the Forensic Medicine Department, the survivor may be examined by the doctors in that department, provided the survivor is not in need of any medical management. In that case, forensic medicine specialist can examine the patient, survivor. Coming to the informed consent. In case of a child below 12 years, consent of the guardian is mandatory. And above 12 years, the child survivor can give consent for physical examination and collection of the evidences. If the child is intoxicated with any drugs or alcohol, consent of the guardian is must. When the child survivor came with a requisition from the competent authority, consent from the person accompanying the child or a woman nominated by the head of the institution, she is considered as the disinterested third party and she can give consent. So informed consent should be in a language which the survivor or guardian able to write and understand. So before taking informed consent, we have to inform regarding the examination to the child and the guardian. So the doctor should explain the nature and purpose of examination and the collection of material objects, and he should examine that all parts of body, including genital parts, may be examined when necessary. Then expected benefits and risks of this examination and reporting. And doctor should explain that the findings of the examination will be intimated to the police and the court. So written informed consent is mandatory before starting with the examination. So informed consent, usually it should be written by the child if he or she can read and write, or by the guardian. അതിങ്ങനെയാണ് എൻ്റെ ശരീര പരിശോധനയും ആവശ്യമായ മറ്റു പരിശോധനകളും നടത്തി ഞാൻ ലൈംഗിക ചൂഷണത്തിന് വിധേയമായിട്ടുണ്ടോ എന്ന് നിർണയിക്കുന്നതിനും എൻ്റെ ശരീരത്തിൽ നിന്ന് ആവശ്യമായ തെളിവുകൾ ശേഖരിച്ച് പരിശോധനയ്ക്ക് അയക്കുന്നതിനും അതിൻ്റെ ഈ പരിശോധനകൾ നിഷേധിക്കാനുള്ള അവകാശം എനിക്കുണ്ടെന്നും ഡോക്ടർ പറഞ്ഞു മനസ്സിലാക്കി തന്നു. അതിൻ്റെ വരായികകൾ അറിഞ്ഞുകൊണ്ട് സ്വമനസാലെ പൂർണ്ണമായും സമ്മതിക്കുന്നു. ഇങ്ങനെയാണ് ഇൻഫോം കൺസെന്റ് എഴുതേണ്ട. ഒരു ഫോമാറ്റിൽ സൈൻ ചെയ്യിക്കുകയല്ല വേണ്ടേ. ഇറ്റ് ഹാസ് ടു ബി റിട്ടൺ ബൈ ദി ചൈൽഡ് സർവൈവർ or parent or guardian or the person nominated by the CWC or the custodian of the child. So the child, the parent, guardian or the person in whom the child reposes trust has the right to refuse either a medical legal examination or collection of evidence or both. In any stage of examination process and collection of evidence, they can withdraw from this consent. So at that time, we have to reassure the child regarding the importance of the child and the guardian regarding the importance of this examination. And again, we have to ask for consent. If they are not willing, we can this can be abandoned. Examination can be abandoned. And informed refusal has to be taken from the child or the parent or the guardian. And it should be signed by them. And even though the child is not willing for examination, or the parent is not willing for examination, we have to provide essential treatment to the child. That is mandatory. So informed consent must be signed by the survivor, a witness, and the examining doctor. Signature with date and time has to be there. Then if the child is illiterate, or the child is not able to read and write, or the parent is illiterate, the examiner or the doctor should write it and read it over to them. The signature and left thumb impression of the survivor or guardian has to be taken with date and time. Then the signature of the disinterested third party with her or his name as address has to be taken as witness. And below that, the doctor has to sign, and he should write that this consent was written by me and read over to the child or guardian. If refuses to cooperate after consent, examination may be abandoned. If after giving informed refusal from the parent or guardian, and if the child again decides to get examined, so this has to be informed to the Child Welfare Committee, and they will give an order. They will send a person, and examination can be done after obtaining consent from the person nominated by the CWC. That the person will be nominated as a guardian of this child. And if the doctor has any reason to believe that the parent or guardian himself is the perpetrator, inform the matter to the Child Welfare Committee and shall obtain consent from the person nominated by CWC. So police personnel should not be present during any part of examination. Even though police was bringing the child to you, the police person will not be permitted to present inside the room. And strict confidentiality should be maintained. Coming to the history taking, interaction with the child should be in a compassionate manner, unbiased and impartial, and do not pass any judgmental remarks to the child, and create an environment of trust. The doctor should convince that the sole purpose of examination is to ensure justice to the survivor and for the community. So adequate privacy should be ensured during all stages of history taking and examination. History obtained should be written in the survivor's own words. There should not be leading questions should not be asked. Record time, date and place and type and nature of assault. The number and name of assailants should be written in the history. If not, if the identity of assailant is revealed, it is better to also have a counter signature of the informant in the format. The state of consciousness and orientation of time and place at the time of assault should be noted in history. Any history of physical violence, any use of weapons, history of forcible administration of drugs or alcohol. In case of this penetrative sexual assault, pain on urination or defecation after assault. Vomiting and post-assault activities like bathing and washing the body part involved in the assault, especially in penetrative sexual assault. Whether assailant used condoms if the survivor can recollect it in case of penetrative sexual assault. To elicit history of the assault, we can use the drawings of the child can be used, drawings by the child can be used, or illustrative books, body charts, or a doll. this picture is a drawing by a 6-year-old child who was frequently assaulted by a bus driver of the college school bus. This picture is drawn by him. It's a picture of school bus. So from that picture, we can assess the this history. Inquire and record in simple language whether these acts occurred or not. If the history is given by other informant, name, signature, address, and relationship of that informant with the child should be written in the format. And in case of child come with injuries, vaccination history regarding tetanus has to be asked. If there is past sexual abuse, that should be recorded. By the same past sexual abuse by the same person or any other person, that has to be recorded. If there is not adequate space in the pro forma for recording the history, we can use additional sheets, and the doctor should sign below each sheet. Examination part. Here also adequate privacy should be maintained. 2 marks of identification has to be taken. It should be on the exposed part of the body, and it should be permanent and individualistic. Left thumb impression is put in the space provided in the proforma. Examination should be done in presence of parent or any person in whom the child reposes trust. When child survivor is brought with the requisition from the police or competent authority and with the escort of a person other than the parent or guardian, the person escorting the child can be present at the time of examination, or a woman nominated by the head of the institution can be present at the time of examination. Police personnel is not allowed. So in case of penetrative sexual assault, maximum reported time for detection of spermatozoa in case of girls in vagina, it's up to 96 hours, cervix 7 to 10 days, mouth 7 days, rectum 31 days. But we usually get these children days or weeks or months after this assault. Local examination. Local examination of the genital area is not, as per the latest guidelines, local examination of genital area is not necessary in all cases, but in small children, this especially the history is not related to the assault in genital areas. In that cases, it is not mandatory as per the guidelines, but it is safer to examine the whole body during the whole body of the survivor for our safety. So oral cavity should be examined: vagina, breast, penis, scrotum, then urethra, anus, buttocks, thighs, any discharge of thick viscid fluid, then blood smearing of skin and mucous membrane with thick viscid fluid, then swabs taken from suspected area. Usually swab this suspected areas of seminal stain. The swab will be taken with the help of a cotton soaked in distilled water. Then pubic hair matting should be noted. Smearing with blood or thick viscid fluid in case of girls, if relevant as per history. So examination should be done in accordance with the history given by the child. Look for foreign body or particles. Then unhealthy mucosa, infection, ulcers, evidence of sexually transmitted disease, swelling, congestion or reddening of the reddening and tenderness of the genital areas. Then injuries like nail marks, bite marks. This is a bite mark on the cheek. Then contusions, infections, color changes of wound that will indicate the stage of healing. That will give clue to the time of infliction or time of occurrence of the sexual assault. Then injuries like smearing with blood or thick viscid fluid, then inflammation or healing of the injuries. late complications of injury, recent tears of hymen with age of the tear in case of girl child. So the recent tear will show bleeding edges or signs of inflammation. This is the laceration in the fourchette and perineum in a girl. Usually, as per law, two-finger test is should not be done, but vaginal examination may be done to look for injuries and tenderness. So injuries will be present only in 1/3 of forced sexual intercourse only, sexual intercourse cases. So absence of injuries does not mean the survivor has consented to the sexual activity. And as per law, if resistance was not offered, that does not mean the person was consented. Most of the sexual assaults are without any involvement or direct involvement of genital areas, and there won't be any injuries in that case. Examination and treatment needed may have to be performed under general anesthesia in case of minor childs, small childs, and when injuries inflicted are very severe. So during general examination, all systems should be examined: pulse rate, blood pressure, that has to be recorded. Then general, whether the child is oriented in time, conscious and oriented, whether the child is oriented in time, person and place, that has to be recorded in the, as per, all these are given in the pro forma for sexual offense victim examination. This is a picture of anus showing scarring. This one is patulous anus. The sexual assault associated with pregnancy, in that cases, if pregnancy is suspected, urine sample has to be collected for confirmation and for doing urine pregnancy test, and period of gestation is assessed by doing ultrasonography. If the child is pregnant, provide necessary advice and assistance for MTP as per the provisions of the MTP Act. And if MTP is being done, then preserve the embryo or fetal tissue or fetal blood for DNA profiling. Then fetal tissue should be preserved in saline. Coming to the police intimation, doctor is always bound to inform the police as per law. It can be done over phone or email. Intimation can be done to the nearest police station. All intimation should be confirmed by a written intimation. Intimation slip should be separate for sexual offense survivor examination, and confidentiality should be maintained regarding the name and address of this child. So material objects collected should be immediately handed over to the investigating officer in a labeled and sealed envelope or container. And in cases where survivor directly comes, it should be recorded in the police intimation that material objects are collected and preserved, and that have to be taken immediately for examination. Mainly 16 samples are required to be taken, and we have to collect these samples as per the history in each case. The main samples are collected in both in male child and female child. Both together 16 samples are this was given by the Ministry of Health, Government of India. That vaginal swabs for detection of semen and spermatozoa, vaginal smear for spermatozoa detection, nail clipping for detection of foreign fibers, particles, epithelial cells, hair, etc., loose hair combing, from pubic region for foreign hair detection, cut pubic hair, cut scalp hair. Both these are for comparison with the hair of the assailant. Then buccal swabs for detection of semen and spermatozoa, anal swabs for detection of semen and spermatozoa, swabs from skin of thighs. It is taken with a cotton soaked in saline. Then loose hairs, if present, in case of survivor brought immediately after the penetrative assault or severe assault, then loose hairs from the anal region and buttocks for detection of foreign hair. Then urine pregnancy test, blood and urine for chemical analysis in suspected case of alcohol intake or drug intake. Then swabs from skin of thigh, fetal blood or products of conception in saline for DNA. Fetal blood is taken in EDTA bottle for DNA profiling. Any other samples as the case demands has to be taken. If we are examining the girl, this child after 7 days, we need not preserve all the material objects. In any case, but in any case, it is better to preserve vaginal swabs in all cases where its preservation is relevant and survivor is brought within a week, since this period will cover all the theoretical possibilities for detection of DNA evidence from it, and it will prevent possible allegation against the doctor with reference to non-preservation. It is very difficult to get difficult to get positive report after 2 days, actually, or more precisely after 96 hours. At any stage during the examination, if the child refuses to do further examination, examiner should stop by giving a short break. Again, after reassurance or after talking with the child, he or she again refuses for examination, then informed refusal has to be taken and examination should be abandoned. Next situation is if a child stated is below 18 years and comes without proof, then a medical board should be constituted by head of the institution, and head of the institution is the chairman of the medical board, and any of 2 specialists from among orthopedic surgeon, radiologist or dental surgeon and physician as members. A lady medical officer substituting any member if the survivor is a girl child. That is the board constituted by the head of the institution for age determination. In government medical colleges, age determination can be done in Department of Forensic Medicine. So in case of consultation, if needed, it should be arranged in the same room where the child is examined to ensure privacy. Confidentiality should be maintained. Consultation is necessary in cases where other diseases like sexually transmitted diseases or any when the child requires psychiatric consultation. In all these cases, the consultant should visit the examination room and examine the patient. The report of examination is exempted from the Right to Information Act. Another situation, referral to higher center. In case of non-availability of specialists for consultation, life-threatening situation and facilities and specialists are not available in that hospital, the patient can be referred to higher center. Before that, the doctor has to stabilize the patient and ensure that the patient is reaching the higher center safely. Into the opinion part. In the pro forma for examination of the survivor of sexual assault, the 3 opinions are given. Findings are consistent with history stated by the history of stated sexual assault. Findings are inconsistent with this history stated by history of stated sexual assault, and findings are seemingly findings are consistent with the history of stated sexual assault. Like positive findings are if present, like injuries corroborating the history of stated assault, then the opinion can be given as findings are consistent with the history of stated sexual assault. And second opinion is findings are not consistent with the history of stated sexual assault. Findings of examination reasonably rules out the possibilities of the sexual assault stated in the history. There is no evidence of this sexual assault. We are sure that there is no evidence of the sexual assault, then we can give this opinion. Then findings of the examination are seemingly inconsistent with the history of stated sexual assault. This is a controversial opinion. There will not be any positive findings in two situations where no findings can be expected. So, then delayed examination. There won't be any history of penetrative sexual assault or penetration. Then we cannot get any findings. And then in case of delayed examination, the child may be coming to you even weeks or months after the alleged assault. Then we won't get any findings. In that cases, we can give this opinion. It is a controversial opinion actually. Then next part is there is evidence of recent penetration of that body part. In that case, there should be findings or injuries corroborating the stated history of recent vaginal or anal or oral penetration or penetration of any part of the body. When there is presence of any injuries, we can give opinion as if it is consistent with the history given by the child, then opinion can be given as the injuries could have been caused as stated. Then if there is injuries, if it is not fresh injuries, that is more than 24 hours, then age of injuries and whether the age of injury is consistent with the stated time of occurrence should be added to the opinion. So in case of opinion reserved pending the reports of the chemical analysis should be noted in the column provided. Any other opinion regarding any relevant history or findings should also be furnished. Then opinion regarding recent vaginal or anal or oral intercourse based on detection of human spermatozoa. It can be given later after receipt of the chemical analysis report. Then reasons for each conclusion arrived at should be recorded in the column provided on the basis of history and examination findings. And this examination report has to be in triplicate form, and original should be given to the investigating officer or the judicial officer. Then duplicate to the survivor, and triplicate should be kept as an office copy. So in case of any disability noted during examination, that and there is disability certificate is not available or previously disability examination has not been done, then a detailed evaluation by the special medical board has to be done. Coming to the conclusion, the value of medical evidence is an important component of the medico-legal investigation of sexual crimes. A negative medical opinion do not negate the occurrence of the crime, and the medical evidence is corroborative in nature. That's all. Thank you.
Thank you, Shalini, for the elaborate presentation. Thank you. Now we'll go for the discussion. Ashwin sir?
Yeah, there are a couple of questions here in the chat box. We'll take that first. First question is on, sorry. Regarding the age criteria for informed consent. I think Dr. Shalini has mentioned briefly about it. Can you just highlight once more, Dr. Shalini? age criteria for informed consent.
If the child is below above 12 years, consent has to be obtained from the child, and below 12 years, in case of child below 12 years, from the guardian or the parent.
I think there is a difference. I think Dr. Moolayil can highlight on that.
Yeah, I will tell you, because there is something, the basis of consent is what is known as gilly competent child. So below 12 years, you have to get the consent of the guardian. Between 12 and 18, it all depends upon the, the ability of the child to understand the consent, what is written in the consent. That is very important. That is why it is known as gilly competent child. Mean a child between 12 and 18 who can understand the consequences of what she is signing for. That is a
actually
difference.
In both cases, consent of guardian should be taken for safety purpose.
Yeah, because that's a legal situation. A child can give a consent because examination, but for a child, for a procedure which may cause a serious injury or a death, then the consent of the guardian also is a must. Otherwise, for minor things and the examination, a child can give.
As far as the law says, you can give consent for a medical examination, for doing any investigation, for taking any evidences. Under 18 years, you have to get the informed consent of the parent. That is the law says like that. Next question is medical expert for sample collection and examination in a male child. Dr. Shalini?
Duty medical officer can examine.
I think you have mentioned it.
Only for a female child, the lady doctor should be there.
If the victim is brought to a hospital, if they comes to a clinic or home, how will you inform the police? Dr. Moolayil, I think you can say that.
Yeah, actually, we have already said that any case of sexual abuse, suspected sexual abuse, you have to inform the special juvenile police unit or the local police. Give the information to them in the correct format, and it is up to the police to make the investigation after that. And our examination part, everything is coming.
Next is the custodian of sample collected for forensic examination. I think Dr. Shalini has mentioned it. It has to be handed over to the investigating officer. I think that's right. So suppose the victim family doesn't reveal even after repeatedly asking and then later come to know about the abuse, will the first doctor be responsible? This is a tricky situation. Many a time they may not say willing for that. If later on they may come and say that they need a medical examination, or they may say it's an abuse. As far as the doctor is concerned, it is for our safety, it is always better to record everything properly and record that we have informed the person in detail regarding the information to be passed on. Since they are not willing, you are not sending it. That part we have to be very clear. Then we will be safe. I think it's.
Ashok Kumar, I just want to tell you one thing. See, it has happened in some instances, where they are given a false history. But then the doctor has to record the history which was given by them. And if on examination, or if the doctor gets some positive findings of some sexual abuse, then it is always better for the doctor also to inform the police concerned authority, so that you are making yourself safe. You may be wrong, but you are giving the information in all good, good sense actually.
Next question is, please explain grooming in child sexual abuse and role of pediatrician in grooming. I think this is a totally different big area to be discussed. Just I try to get my slides on grooming, but it is not coming. You should understand that grooming is not by the pediatrician. Grooming is by the culprit. The grooming is done by the culprit to see that the child is become a what you call a person who's conformed to the process without reporting it. So it is a process. I think it is a topic itself to be discussed in detail. Dr. Moolayil, can you explain it?
What is the question?
Grooming.
Groom?
No. I think I will be a better person to talk about grooming. As such, grooming is the process while the child, while the what you call the adult. I think there is a background noise. Balachandran, can you mute others?
Okay, sir. It's done. It's done.
Some problem with the clarity.
I thought it was coming from you, Ashok sir.
No. Mine side is clear.
Yeah.
So grooming is the method of. I think this is the point we have to be a little careful. Grooming is a method by building trust with the child and adults around, and this will help the culprit to get access to the child. And the purpose is that the child will become a what you call a cooperative participant, and whatever the child tells the family, the family will not be accepting it, because the family sees as the culprit as a person, very nice person, and very much interested in the child, and they will never accept that the culprit is going to act like this. So that is the process of grooming.
Actually, you mean the culprit getting the confidence of the family, getting into the confidence of the family.
He appears to be a nice person.
Yeah. You are talking about grooming. Yeah. That is how it's a planning by the culprit to get into the good books of the family and the child also.
I thought that the question came as the role of pediatrician. I wanted to mention you that
we don't have any role in that actually.
Okay. If the guardian or child not willing to give informed consent and informed refusal, what to do? I think Dr. Shalini has mentioned about that. I think, can you just elaborate on that, the procedures, what to be done, Dr. Shalini?
Actually, we have to try to convince them. If they are not willing, we can take informed refusal from them, or if they are not willing to give refusal also, then we can write down that the situation, what happened there, mentioning the date and time, and then that has to be recorded.
I think both of our we have highlighted that point also. I think if they don't give the permission, we should not proceed with that.
If you feel that there is a history of abuse and abuse has taken place, we have even there is an informed. If the parents are not willing, it is our responsibility to see that maximum effort is taken to get the consent and do the treatment. And we have to tell them that even they are not interested to go for a police case, we have to get the child treated first. To tell them that the therapeutic aspect has to be mentioned to them, and you treat the child first. Then you can approach either the child line or the child welfare committee. They have got good counselors. Through them, you can manipulate or tell the family to the advantages of the treatment as well as going for a medical examination and police cases.
Now, I want to highlight one point here. In case of an emergency means you have to do something to prevent deterioration of the condition of the child. Emergency treatment. For that, even if you don't get the consent also, you can proceed. That is the aspect in other things also. Even for Pocso, otherwise also, even for a treatment of a child, you can proceed with emergency treatment despite the refusal of give a refusal from the side of the parents. That is the courts are ruled like that.
And there is a big question. Most victims are likely seen first in a small clinic run by a single doctor where none of these procedures are possible or difficult. The procedures are perhaps not needed in most cases of abuse and only suspicion is there. Making an error of judgment can cause serious breakdown of family relation. Social service department should have a greater role, visit house and neighborhood and collect evidence in suspected cases. Any comment by Dr. Moolayil?
Is it a comment or is it a suggestion or a question?
There is a question also. You said, should we inform the social service department to get the evidence? I think that's not the correct thing.
That's not the correct procedure. Correct procedure is, any case of sexual abuse or suspected abuse, as I already said, you have to inform the police, SJP or local police. There is no doubt about that.
Can you see the chat box and see the question?
Just one more thing. Let me add one more thing for that. Even if the person is, if it is not even now ordinary person is bound to report.
Yeah, that's the
they don't have any facility for examination, but when they come to know about such a sexual abuse, they are bound to report. Section 19 is applicable for them also.
And there is another question: is most of the procedures Dr. Shalini has described as if there is a penetrative assault or a rape or something like that, what is what is the evidence collection in other cases where there is no serious assault or happened, and in cases of sexual harassment and other things? Dr. Shalini?
Actually, these material objects are collected according to the history. So, in case of no penetrative sexual assault, actually I have no option to collect material objects. But in smaller children, especially in girls, the genital area examination and the swab collection is better, is safer. Actually, I can't elaborate more in that topic.
Actually, what is done is that depending upon the medical history, if you have a case, then only the upper part of the body, there is a what you call manipulating the breast or pressing the breast or kissing or something like that. There is no point in examining the genitalia, because if the genitalia is not involved, if you are going for an examination of the genitalia, it will be more traumatizing for the child. You are unnecessarily putting pressure on the child. So it is the responsibility of the doctor to see that what are the things has happened for the child, and you have to take the history properly and do the medical examination accordingly, so that there should not be any amount of re-victimization of the child. That also has to be taken into consideration. Then another question is, if following an examination, if no one is not able to confirm or comment on the state of hymen, what would be right, as on not all adversely affect the verdict? Your comment on that, Dr. Shalini?
We are expected to know the findings in the hymen as MBBS doctors. So, findings comment
I
think you can do one thing. You can say whether it is intact, torn, or lax. Whatever you're finding, you write down. That's all.
That's all.
That is what we need, more training for our doctors to see that the proper recording of the evidences has to be taken place. I think the questions in the chat box is over. Any other questions from audience?
I think Ashok, I think somebody has asked a question whether we are all talking about the findings in penetrative sexual assault. What about other things? That's some. I think one question has come like that, isn't it?
Yeah, that was I was asking about other things.
Actually, here what you can do is, see, probably as Sally has said, the victim may be coming after months after the actual abuse has taken place. They may be coming with other vague symptoms, etc., etc. So you have to take the history, go into the findings, then you have to inform, because once it comes to your knowledge, you're about to inform and let the police or authority make the investigation. There can be sexual harassment, could be there, non-assault, plain simple assault can be there, harassment can be there, pornography is there. So many things are there. But now our topic is regarding the role of doctors. When we get a patient or a victim, what we should do, one thing. And she has talked about the examination findings, how to examine, how to report, how to take the specimen, etc. That's a topic here. But otherwise, whenever you come to know about any kind of sexual abuse, any kind, let it be what I said, we are bound to report.
I think any other comment from anybody?
Could you question, sir? One more question is there.
One more thing.
Is it compulsory that the victim to be taken to the government hospital?
No.
Actually, there is in Kerala, I think the government, law, even though there is no written law, even if have a couple of experiences when the private doctors has complained, they were again taken to the government hospital to take the medical examination. That is again is a second time torturing the child. In all other places, other states, it is any doctor can do. I don't know. I'm right.
Can I clarify? Because as I have said earlier, the Act says that, the rule also say that in an emergency, you have any primary hospital, private hospital also can give the treatment. And the other thing is that if there is a government hospital, the patient can be attended to there. They have to be attended to there. But in the absence of a government hospital, private hospitals can take over the case. That is what is written.
And I wanted to ask Dr. Shalini, what is the basic difference between the government, Women and Child Development Department guidelines and Kerala guidelines? I have both the copies are there. There are some differences are there, in fact. The one is a 16-page pro forma and another is a 10-page pro forma. And one point I have always tell almost all the classes that even if you are using the Kerala guideline, you should have a copy of the national guideline, because how to write the opinion is best given in that in a tablet manner. And even if you are following essentially there is no difference. Everybody is doing it for the welfare of the child. But because of some maybe ego issues or something like that, there is some disparity in the thing. And I have contacted and talked to so many people that they cannot settle it so far. Anyway, I request all the members to see that they have a copy of the Women and Child Guidelines book. It clearly denotes point by point. If at all there is a confusion in the state thing, you can refer to that. Another thing is that in I don't know whether it is you have mentioned in the Safe Kit, iCancel, the association with Enfold has produced a Safe Kit for the examination, and we are trying to provide a drawing of the human body, small drawing which can be used for the child. So you can say that if you take the figure and say that this man has touched this part and all. Even that the manual, there is a where you can mark it, that is there. But we can tell, if you are talking about madam was telling about 8-year-old, 10-year-old, you can say what are the body parts and all. When you are talking to a small girl less than 5 years, they may not be able to tell where they have touched or fondled or something like that. So that you can show that chart. I have sorry that I didn't keep my Safe Kit box with me. So you can say, tell them that where did he touch, what is this, nose, mouth and all, where did the person touch. That is, if you write it and you keep that paper with you and say that these are the places. In as you said, if there is no penetrative sexual assault, these points are also carry a lot of weight in the court of law. I think that is a point which we can mention about if there is no penetrative sex, only sexual harassment or things has taken place.
Actually, half knowledge is more dangerous than no knowledge. We have seen a doctor being harassed only because of that. You know about that, no? We know the case. So actually, what you suggested is a very good thing. Actually,
Sir, I want a clarification for your answer that if a victim comes to your home or clinic, and are we supposed to go to the police station and give the report?
No, Balachandran, it is very clear and straightforward. Your responsibility to inform the local police station. If your local police station, most of the major police station will have a special juvenile police officer. If there is a special juvenile police officer, you can tell them, or you can inform the officer in charge of the nearest police station. Now, the
that I
thing
know.
is that whether they...
I wanted to know whether we have to go to the police station and ask, tell them.
No, you have to either,
Intimate.
as she has already mentioned it, you can send an email or for telephone
By
and
phone.
give the information, and then later you can send a written information also.
yeah.
Intimation.
By post or something.
Always, when you call the police station, ask for the name and the number of the police person who is attending the call also.
That is what I
So
want.
that he can record it.
And as far as in most of the places, I don't know about Trivandrum and Calicut that side, but in Kerala, Thrissur, Calicut, Thrissur, Ernakulam, Palakkad and all the SGPOs are very, very sensitive people. If just tell them that there is a incident in this place, and they will take over the case. And I have a few experience that they just ask them to ask the patient to call the SGPO. Then they have took part in all process of investigation. So it is. Then I request all the IAP branches to be in touch with your nearest police station and all, so that you can give justice. Our purpose is just give justice to the children. For that, immediate interference and proper interference is necessary. I think this is a must. In the future, we have to be much more what you call empathetic towards the children. That's what I always say.
ശരിക്കും പറഞ്ഞാൽ we were actually അശോക് കുമാർ ഞങ്ങൾ actually I cancel group ഞങ്ങൾ ഒത്തിരി വർക്ക്ഷോപ്പ് ഒക്കെ പ്ലാൻ ചെയ്തിരുന്നു. Unfortunately, COVID വന്നു. Isn't it?
I am ready. We are ready. We are ready. We can conduct.
Zoom is a good thing.
I invite Dr. Shalini to join our iCancel group. This is a national. It is a part of IAP, but it is a national society. We have gynecologists, forensic medicine expert, psychologist, and if you are free, please join tomorrow.
Sure,
tomorrow and day after tomorrow, we have two interesting sessions. Tomorrow, Dr. Rajiv Seth, who is the president, chairman-elect of International Society for Child Protection of Children Against Child Abuse and Neglect, is speaker. And day after tomorrow, we are inviting a senior judge to say what is the role, how they see the role of a doctor, and what can you do to give the better benefit to the child. I think I will. You are in Trivandrum, no? I will ask people in Trivandrum to get in touch with you. We need forensics expert. I was expecting Sri Lakshmi also here. Sri Lakshmi in Wayanad Medical College. She is a member of our group. I was expecting her also here. I think so. No, it's all okay now.
So there's one more question in the chat box.
Oh yes, questions are coming here.
What should we do about a girl who is 17 years pregnant and parents do not want a doctor to inform the police?
You have to inform. There is no doubt about that. You have to inform the police because 17-year-old means another karyam under 18.
there are a little bit of controversies in the legal side regarding the age and things. But
consent
no, Pocso very specifically says that under 18, all are to be reported. Now, whether the parents needed or not, I have a personal experience. One of the gynecologists did report after 1 month, she got a summons from the Pocso court. So, for your safety, you have to report it.
പിന്നെ ഒരു കാര്യം കൂടെ ഓർത്തോണം കേട്ടോ, 18 വയസ്സ് കഴിഞ്ഞ ഉടനെ പ്രസവിച്ചു കഴിഞ്ഞാലും നമ്മൾ അറിയിക്കണം. 18 കഴിഞ്ഞ അറിയാമല്ലോ, ഞാൻ പറയുക.
Then there is a question of consensual sexual activity. I think that is still under consideration in the legal side.
അത് 18 ആക്കാൻ പോകണം.
Something is happening, and in Kerala we have another very difficult situation. I wanted that to be looked into in a big way. In Wayanad and Attapadi and all, there are a couple of tribal groups where the marriage, the child girl get married as soon as they get menarche at the age of 12 or 13. That is a legal thing happening in that place, and so many families having problem. The husband has taken they at 13 years or 14 years they get pregnant, go to the hospital, they report the case, then husband is taken by the police. These are some problems happening in places where all these what you call traditions are happening, and there are a lot of issues in Pocso Act which has to be looked into, and we are expecting some more amendment. But as far as the legal law-abiding citizens as doctors, our responsibility is, as soon as we come across a case, report to the appropriate authority, see the child, examine the child properly, treat whatever ailments are there in the best interest of the child, and report, take the evidences if at all is there, and report the police properly, and refer the child to the appropriate authority and rehabilitate them well. So I think that is the message we have to give to all of our pediatricians in the seminar.
Ashok Kumar പറഞ്ഞതിനകത്ത് ചൈൽഡ് മാരേജിന്റെ ആക്ടും കൂടെ ബ്രേക്ക് ചെയ്യുന്നുണ്ട്.
Yeah, but this is a social condition in certain places, not only in Kerala, in so many tribal villages.
Actually, comparatively, Kerala is less actually when compared to other.
These are things which come. I think we have to do a lot of things on this aspect.
But we are going in the right direction now.
Thank you, Dr. Shalini and.
Sir, one last question.
Yes.
Can we give a reference letter to the nearest government hospital and inform them?
No, our primary responsibility is inform the police.
Correct.
Inform the police. That for there is no compromise. Whether you can refer as a doctor, you cannot refer for a therapeutic purpose, or if you don't have a facility, you can refer. But information should be given to mandatory reporting is compulsory unless you will have to face punishment. This
and
point has to be.
Years, sir, 18 years means 18 years and 11 months.
18 years. Completed 18 years.
Completed 18 years.
That is 18 years and 11 months.
18 years and 11 months.
നമ്മളിപ്പോൾ 18 years എന്ന് പറഞ്ഞാൽ from
18 years age 18 years complete ആകുന്ന ഡേ, അതായത് ഇപ്പൊ 19 എക്സാമ്പിൾ ഞാൻ പറയാം 2000 ഇന്നിപ്പം 23rd അല്ലേ, അപ്പൊ 2002 23rd നവംബർ എന്ന് പറഞ്ഞാൽ ഇന്നിപ്പോ 2020 നവംബർ 23rd 18 years ആയി. കണക്കൂട്ടുക അല്ലേ നിഷ?
I don't know why
18 years are the completed day.
Sorry?
11 months from where you do get it?
ഞാൻ ചോദിക്കുന്നത്, if the date of birth is 23rd November 2002.
ഇപ്പോഴാ ഇന്ന് 18 years ആയി completed.
Today that victim is 18 years old.
Yeah.
അപ്പം നാളെയും she is 18 years. 18 years
No,
and
no,
1
no.
day.
Completed the age of 18, attained the age of 18 എന്നുള്ളതാണ്. അപ്പൊ ഇന്ന് അറ്റൈൻ ചെയ്ത് കഴിഞ്ഞു.
അറ്റൈൻ ചെയ്തു. അപ്പൊ അടുത്ത
അപ്പൊ
മാസം
ഇന്നലെ ആണെങ്കിൽ ഷീസ് എ ചൈൽഡ്. ഇന്നലെ ആണെങ്കിൽ
അല്ല. ഇന്നലെ ഷീ 17 years.
17 years. ഇത് അതായത് നമ്മൾ 18 years കംപ്ലീറ്റ് ചെയ്യുക എന്ന് പറഞ്ഞൊരു ഡേറ്റ് ഉണ്ടല്ലോ, അത് ഇന്നാണ് 18 years ആയിരിക്കുന്നത്. മനസ്സിലായി? 2002 എന്ന് പറഞ്ഞാൽ ഇന്ന് 20 ആയപ്പോ 18 years ഇന്ന് കംപ്ലീറ്റ് ചെയ്തു. 23 November ആണെങ്കിൽ. അതേസമയം ഇന്നലെ ഷി വാസ് കംപ്ലീറ്റഡ് ഇയേഴ്സ് എന്ന് പറയുകയാണെങ്കിൽ 17 years ആയിട്ടുള്ളൂ. 17 years and 364 days.
That is what I said. ഇന്നലെ ആവുമ്പോൾ ഷീ 17 years and 11 months.
11 months and 29 days. Okay.
അപ്പൊ അടുത്ത വർഷം 2021 November വരെ ഷീ ഈസ് 18 years. ഷീ സപ്പോസ് ടു ബി 18 years.
അതെ, കംപ്ലീറ്റഡ് ആയല്ലോ 18 ഇന്നുകൊണ്ട്.
അങ്ങനെയല്ല. നെക്സ്റ്റ് മന്ത് ഷീ ഈസ് കമ്മിങ് ടു us and നമ്മൾ ഏജ് ചോദിച്ചാൽ വാട്ട് ഈസ് ഹർ ഏജ്? 18 അല്ലേ? 18.
ബട്ട് മറ്റേതെന്താ അണ്ടർ 18 ആ പറയുന്നത്. അണ്ടർ 18
ആവും.
ഓക്കെ. അപ്പൊ 17 years 11 months വരെയാണ്.
17 years 11 months and 29 days എന്ന് പറയുകയാണെങ്കിൽ.
Sir, 17 years and 364 days.
364 days. അതേ നേരത്തെ പറഞ്ഞത്.
സർ, അപ്പൊ ആക്ട് പ്രീവിയസ് ഡേറ്റിലാണെങ്കിൽ
നടക്കുന്നു, അതായത് ആക്ട് നടക്കുന്ന ഇൻസിഡന്റ് ആ ടൈമിലെ ഏജ് ആണ്, റിപ്പോർട്ട് ചെയ്യുന്നതല്ല. ഇപ്പൊ നിഷ, നമ്മളിപ്പോ ഒരു എക്സാമ്പിൾ പറഞ്ഞു. ഈ 18 വയസ്സും 1 മാസവും പ്രായമുള്ള ഒരു കൊച്ചു പ്രസവിച്ചെങ്കിൽ the act has taken place when she was 17 plus ആകുമ്പോഴത്തേക്ക്. അപ്പൊ ആക്ട് നടക്കുന്ന അനുസരിച്ചാണ് വയലേഷൻ നടക്കുന്നത്, അല്ലാതെ പ്രസവിച്ച ടൈമിൽ നമ്മൾ അറിയുമ്പോഴുള്ള കാര്യമല്ല. ക്ലിയർ ആയി നിഷ പറഞ്ഞ? അതെ, നമ്മള് റിപ്പോർട്ട് ചെയ്യാന്നുള്ളതല്ല. അതായത് 18 ആകുന്നതിന് മുമ്പേ ആക്ട് നടന്നിട്ടുണ്ടെങ്കിൽ വി ആർ ബൗണ്ട് ടു റിപ്പോർട്ട്. നമ്മുടെ അറിവ് വരുന്നതല്ല. അതുകൊണ്ടാണല്ലോ probably you know the case when I think the one girl just completed 18 years. കാരണം കേസിനകത്ത് എഴുതിയിരിക്കുന്ന 18 വയസ്സാണ് പ്രസവിച്ചിരിക്കുന്നത്. പക്ഷെ ആക്ട് നടന്നിരിക്കുന്നത് 18 വയസ്സാകുന്നതിന് മുമ്പെയാണ്. അതുകൊണ്ടാണ് കേസ് മുഴുവൻ വന്നിരിക്കുന്നത്.
I think the documentation is more important. We have to be very careful about it. That is the most important message.